uh, rewatch if we need to. Okay, so yes, we have been very busy at West Virginia Citizen Action. On the national news front, Gary, our co-director, and I went to Washington, D.C. at the end of February, the very end, with our national organization, People's Action. And we had a great 3 days in Washington, D.C. And our first day, we kind of did some grounding and like why we were there. We had folks from around the country who were there. Some were fighting for housing justice and rent prices, and others, like myself, were there for healthcare issues. Particularly, we were down there talking about insurance denials and the greed of the healthcare insurance industry. And then there were others who were there for climate and energy justice. So it was a great group of folks, and we all learned a lot from each other. And we kind of, like I said, grounded, got to know each other. And then on Tuesday, we went and spoke to members of our legislative team. So Gary and I went to, we had an appointment with Capito's office. It was not with Capito herself, but her health policy director, and who is Dana Richter. She is a lovely woman. I do enjoy her. She's very nice to talk with and very sympathetic. She can't help who she works for. uh, but she listened to our concerns about cuts to Medicaid, and felt that the state really can't absorb any cuts to Medicaid. Now, she said, will that translate to how the senator votes? I can't say. So, but she, as always, offered to pass along our thoughts. And we talked to her about, how it's going to affect nursing homes. It's going to affect birth to three, the intellectual and developmental disabilities waivers, and feeding programs for children. And the reason is that those are all optional programs. The federal government has specific guidelines on what they have to provide. And so these things fall, those other things I just mentioned, like nursing home care and, all of those other things are considered optional programs. We know they're not optional, but that's what under their guidelines. So we talked about how those things being ripped away is really going to impact our citizenship, because over 50% of our children rely on Medicaid. Over 40% of our population relies on Medicaid. So, and the services that they provide. So we spoke to Dana about that to pass along to the senator. Then we went down to Congressman Riley Moore's office, and just by chance, he was in the little walk-in lobby area when we walked in. So I perked up and it was like, ding, ding, ding. And he was talking to some other folks, but as soon as he was finished, I attacked. And he did speak with us for a few moments and said, I don't know where people are hearing about this. We don't have any plans to touch Medicaid or SNAP. It's just rumor. I don't know where people are hearing about it. Well, that day he needed to go down, and they were rushing him to talk to us because he needed to go cast his vote for the budget reconciliation bill as a yes or a no. And what that was going to do is send the budget, what they set as like the bottom number, to the committees. And then the committees had to decide where the cuts come from. So yeah, it was a procedural vote, but it wasn't. This was going to set some numbers. And I said, well, are you really sure about that? Because with the amount that you're wanting to cut, unless you're going to cut the defense budget, you're not going to get there in the math without severe cuts to Medicaid. And it kind of blew me off. But he did say to my face, we're not touching Medicaid. And then 10 minutes later, walked down the hall and voted for the bill that is essentially going to cut Medicaid. Yeah, it's going to force cuts. And let's see what's it. Carol Miller's standard letter response claims that the continuing resolution does not involve cuts to Medicaid. My understanding is that the CR will force cuts because it adds some expenditures. Can you better explain this and when we might expect to see cuts? This is precisely the line you are describing, Miley. Yes, 100%. That is exactly the party line that they're giving. So what that will do, well, they have to come up with a budget by, is it July 1st, I believe? So they have to have a budget. So that is, and anytime after that is, once the budget is approved and signed off by the president, then those cuts would go into effect because they're pretty much immediate. So yeah, essentially what they're doing is, well, the CR was to stop a government shutdown. They have to come up with a budget reconciliation, like an actual budget for fiscal year 2025, which would start July 1st. So it's they're kind of two different things, but they do work in tandem together. Yes, Sally, I see you waving. Are you good? Okay. If that makes sense. It's unfortunately numbers aren't my game, so I kind of have to depend on folks to kind of help me through that process. So bear with me there. So yeah, they're repeating the party line. They're kind of talking out of two sides of their mouths. So it's frustrating. But we went down to Jim Justice's office. He was not there. People were coming in asking where Baby Dog was. And I guess he's telling everybody just to come see Baby Dog. Baby Dog was out for a vet appointment, unfortunately. I did not want to see Baby Dog. I want that poor dog to have some peace. So I was not trying to put that poor dog through anymore. But yeah, he was, I guess, going around telling everybody just come to his office to go see Baby Dog. And Carol Miller's office pretty much refused to see us, talk to us, or anything. I'm not her constituent. I'm Riley Moore's, but Gary, our co-director, is her constituent. So that was a bit frustrating. We were able to leave some information that we had compiled regarding cuts to Medicaid and SNAP and how those would impact the state, but I can't say one way or the other if they received them. Right, exactly, Phil. Phil says, great, glad you're not cutting Medicaid. So tell me what cuts to meet the 880 billion you'll be voting for. Exactly. So that was a really good day. I was exhausted. And then we went and talked to some of, yes, they do represent all of West Virginia, Sally. And then I went with a group from People's Action and the Chicago People's Lobby. And we talked to some of Bernie Sanders' head finance folks about things that we could try to propose, next session or later, that, what the appetite would be for getting restrictions on insurance companies being able to deny claims and pre-authorizations. They really said a lot of people are really kind of keyed into the Medicare Advantage plans that we've talked about previously in these meetings, and that they understand, even at a bipartisan level, they understand that these are pretty predatory. And so he said, you've got folks who are, keyed in by the lobbies, but that there is probably some wiggle room to get some type of legislation through connected to the Medicare Advantage plans and pre-authorizations and claim denials. So on a national level, with our People's Action National organization, we're probably going to help work and try to spearhead that with them, because we have a high Medicare population as well. And we don't want to see those folks being ripped off and taken advantage of. So that was a really good conversation. It was good to see where those things where we might meet a little bit. That was good to hear and promising. Of course, we want more. We want to be able to go after the entire industry as a whole, but that's not where we are right now. So we're going to work with the little piece that we can get and make inroads there. So we're working both at the state and national level for you with that. I wanted to ask, because I wasn't able to, wait a minute, did I just skip like half of my? No, I did not. Okay. Oh, okay. I see what I did. I just put it in the wrong thing. In Morgantown on Monday, I helped organize and execute two direct actions at Riley Moore and Senator Capito's offices. We took about 60 people, which was amazing, on a Monday at noon. And we had less than 72 hours to organize all of it. So I'm feeling kind of proud about that. But we had about 60 people show up. I had about 6 storytellers who were directly affected either as healthcare providers or directly affected as patients, and dependent on Medicaid, and those services, those optional services that they have. And so it was really powerful. In Riley Moore's office, his district manager or district coordinator, I think was his title. I can't be, but his name is Riley Hawkins. So Riley Moore, Riley Hawkins, was there and did sit down and listen to all of us for 45 minutes. And I think I scared him a little, but I'm okay with that. Because I said, these are resources that our state depends on. And it's children, it's also elderly, it's also, our disabled communities. I said, and the amount of fraud that has been studied in West Virginia, we have fraud investigators in every county. And the majority of fraud is being reported by providers who are, trying to either mismanagement or by, simple error. I said, but why aren't we investigating that? When the majority of fraud, waste, and abuse is coming from those types of errors or potential, or on purpose things, why aren't we investigating that? Why are we going to cut access to people from healthcare? And I said, I think we can all agree that healthcare is a human right. And he goes, if you're asking me if I approve of national single payer or, a plan, he goes, I absolutely do not. And I said, okay, fair. I said, however, I would like to ask the congressman, what's his, what's the acceptable ratio of death that we're willing to accept? And he got really upset with me on that question and started looking to the other people to talk. So I let everybody else talk then. But as this was happening, the building owners were trying to kick my people out and have them towed. We were outside. We left plenty of parking in front of the businesses. We did not impede anyone. He is at the end of a whole strip mall kind of thing. We were at the end. We were not blocking anybody's doors. We were not doing anything. So I had to kind of go and negotiate people not getting towed. But yes, they did kick us all out. But the protesters went down to 705, which is a major thoroughfare through Morgantown, and protested away until they got threatened with their cars being towed again. So then we moved to Capito's office, and we chanted out there for a bit, and then I took those same folks up to her office on the 5th floor with me. You have to like ring a doorbell. They have like a ring camera thing on their door, and they would not answer the doorbell. And then so there was a number you could call that was on a placard, and so I called that. No one would answer, but it picked up to voicemail, and so I've requested a meeting with someone in that office so that we could let these people tell their stories. And one of our demands for both was to in the April recess, which is for 2 weeks, to have a public town hall or several small group meetings in person. And of course, nobody's committing to that. So we'll see how that goes. But we have, at least in Morgantown, where I think we're planning to escalate, maybe if I need to talk with the folks I was organizing with first from Mountaineer Indivisible. But you know, I think there's appetite to go back and, you know, and hold them accountable yet again. But I felt like we got lots of press. I have links to all of that, and I will send it. We were featured on Rachel Maddow, so we got a shout out from Rachel. So that was exciting. I'll send all these links in the follow-up email to everyone, so you can watch those. Patricia's asking, is it possible to list the numbers of services that have funding cuts already? I will try to get those numbers. I'll get with the West Virginia Center for Budget and Policy. I bet they will have some numbers for me for that, because they follow that stuff very carefully, and they are the team that really takes gets out good information on that stuff. I was not able to attend the Beckley Town Hall that none of the congressional delegation showed up for. Was anyone able to watch that on the live stream? I was busy planning our action here on Monday. So if anybody has a report back on that, I saw Sally's hand. Anybody else? Sally, you go ahead and give us your feedback, and then if anybody else has any additional thoughts, I'm happy to hear it.
Well, if anyone else has thoughts, please share. It was excellent. I see Carol here. She helped, one of the people that helped organize it, I think. So
hi, Carol. Thank you.
Oh,
very well
attended. No, I didn't help organize it, but I was there.
Oh, okay.
Yeah, it was something else. It really was. Yeah, we need to do that more often.
It was incredibly well attended. I heard that I shared it on our Rise Up page, so I was live streaming. I wasn't there in person, but I heard that it was standing room only, that the room was packed. The presentations were excellent. It is now, I believe, up on the Democratic website, and
okay.
I'll find that before I get off, but so that you can watch it if you didn't get to see it. Excellent questions posed, excellent information about how these cuts are affecting, federal cuts are affecting people in our state, both at the federal national park level, at the agriculture level, how it's going to affect our farmers who provide school lunches right now, and take away those school lunches and some of the fresh foods that are available to people, lower income people. So it was very informative, even if you're well informed, I thought. and I'll try to get the link.
Thank you. And I'll include, if you have the link, I'll definitely include it in the follow-up letter. Oh, Jan, yes. Yes, Jan.
I found it very inspirational. It was well moderated. The empty chairs were very prominent, and it was encouraging.
That's great to hear, because I think we all need that right now. Absolutely. Linda is advising us of a Medicare scam going around. She just got caught in one an hour ago. Received a call and said they were from Medicare. We're going to send out new Medicare cards. Always be vigilant. Do not get overtired or have your attention diverted. Medicare is not sending out new cards. They wanted my current card number and gave me a new number over the phone. Medicare will call you and let you know a new card is coming with a letter. They will not ask you for any of your current information because they already have it. Since I was distracted, I got caught. I called Medicare and told them what happened, and they canceled my old card and going to send me a new one. Thank you for that, so that we can make people aware. We'll put out, I'll make note of that, and we will put something about that on our website and send out to our members as well. So even the people who aren't here can be aware of that potential scam. We don't want others caught in that. So thank you very much for giving us that information. That's really important. Okay, anything else from Beckley we want to touch on before we move on? I really sorry. Who said? Oh, John Baldwin. Oh, go ahead. I'm sorry. Who am I interrupting?
Right. I live in Beckley. John lives in Princeton.
Yeah, he said they did a protest in Princeton and it made the news, and that they're planning more. Yeah. Fantastic. I know you got some great people in Princeton.
Yeah. We're having a protest at the main post office here in Beckley tomorrow afternoon. I believe you're also having one in Charleston and other places. I think it's like a nationwide thing on the 20th. So we're having that. And then a week from Friday on the 26th, this isn't just in Beckley, this is statewide, we'll be having another Progressive Democrats of America chapter meeting at 7 o'clock on Friday, the 26th. So
great. So that's Friday the 26th. I want to put that in so we can, let me put it in my notes. Yeah. And that's on Zoom, right?
It is. Yeah. And you'll be getting a link for that soon.
Okay. Okay, great. Thank you. I'll add that to our list of upcoming things, because I want to keep people advised of what's going on. So for our state level issues, if it's okay, we'll go ahead and go there. Nothing is currently moving on Medicaid at the state level, which is kind of shocking. However, the thought is that they're waiting to see what happens at the federal level before they start doing anything. So, so yeah, we've got our eyes peeled, but nothing has really come up yet. Of course, has anything that's going to benefit the state come up in this legislative session yet? Because I haven't seen it. It's been a roller coaster ride of weirdness, in my opinion. Kim Jones, one of our folks, is organizing some folks to attend meetings with some of our representatives at the Capitol on Monday, March 24th. They're going to talk about Medicaid and SNAP, and just kind of, even though it's not coming up right now at the state level, they just kind of want to reinforce that if things do come up, because the Senate still has time to bring bills to the floor, and send them to committee. So we just kind of want to reinforce, we don't like this, this is bad. And then they're also going to talk about vaccines and the doula bill that's coming up that has actually got some momentum, we think, this year. So the midwife and doula bill is a good bill. So we're hoping to get some traction on that. But if anyone is interested in that, in going to the Capitol and speaking with some of the representatives about any of those issues, please let me know. I will pass it on to Kim and she can reach out to you. But I put my email there in the chat if you're able to access that. And if not, it'll be in the email tomorrow. But if you're able to get to the Capitol on Monday, I can send your information to her and she can coordinate with you. I might be there. I'm going to try to get there. So that is the goal. And I'd love to see any and all of you if possible. What else do we have at the state level? We're watching and putting in comments on vaccine and the doula bill. So some important dates that are coming up. The last day to introduce bills in the House was yesterday. The last day in the Senate is Monday, March 24th. Sunday, March 30th is the day that bills must be out of the committees. They must have, either died in committee or come out of it. Crossover day is, sorry, lost my place. April 2nd, which is a Wednesday. And that's when, if things are going to be sent from the House to the Senate, they have to be sent, or vice versa from the Senate to the House for approval. They have to have been sent. The last day of session is supposed to be April 12th. However, we've heard rumor that the state may extend the session so that they can deal with the budget, because we have, what is it? Is it a $400 million, $440 million deficit that we're facing? So yeah, we still haven't done anything to address that. You know what, Jennifer, I apologize. I was hoping Kim could be here tonight, but she's kind of tapped out today. I think, bless her heart, she's a little exhausted. And I meant to ask her because I've been kind of following national and she's been following state so that we can, kind of split our resources. I will find out what the current status of the vaccination. Oh, I do know something. It's been really watered down because they were trying to put religious and philosophical exemptions in there, and I believe those have been wiped out. So those have been struck from the bill. So it's not looking as bad, but I will get in the email I send out, I will get a true update on that for you and what the status is. I just remember us talking about that this morning. It's been a long day, so I apologize if I'm a little scattered, but it's okay. We're doing the important work. So some upcoming events. The April congressional recess will be April 12th through 27th. Morgantown is trying to schedule a town hall with our representatives if they're willing to do so. We're also trying to get some big name folks maybe to come. I don't want to give away too much there, but they are in talks with some folks that might be able to come and inspire us and give us a little hope. So that I know that's what's happening in Morgantown. If you are planning things in your area and want them amplified, or if you need help planning something in your area, use me. This is what I do. And I live to use my megaphone. So my mother said, who made the mistake and let you have a megaphone? So, please let me help you. I have no problem driving around this state. I'm originally from the Beckley area, so I know it well. But I know you also have a lot of great organizers in that area too. But if you need help or support, I've got templates to use. I've got, I've got all kinds of things that we can work with. If you want to plan something for that 2-week, if you want to plan anything, you could reach out to me, but specifically in this case, around that 2-week April congressional recess, let's do it. I mean, let's throw down. Let's make some noise. I don't think we're making enough noise. So let's, like I said, any excuse to take my megaphone and travel. So I'll use it. Absolutely. Oh, we have such a great environmental team, Rachel. They really are. We have a great environmental, petrochem, energy, folks. I mean, they speak languages I can't even understand, and they are so passionate and so amazing. And I am happy to put you in touch with those folks. Just please reach out to me, and I'll make, email introductions and get you tied into those folks. They know their stuff, and they do this all the time. So we're happy to help with that. National Single Payer Day is May 31st. I am hoping to work with Rise Up and PNHP West Virginia as partners and work out an action. We're trying to get a meeting scheduled as we speak so that we can fight for a single payer, health plan and let people, we might not get it now, but we're at least going to let people know we want it and try to make strides in that direction. Does Riley Moore have an office in the Eastern Panhandle? Let me look that up real quick. I can find out quickly for you. He did. You know what happened? I found out on the news that he had a ribbon cutting for his Morgantown office today. Man, if I had known about that, I would have been there with my signs and my bullhorn. Absolutely. And then I was like, because he had a whole bunch of people there, and I was like, did they get threatened to get towed? They're all outside. They've got press. They're, disrupting business. And the funny thing is I used to work at the travel agency that is just a couple doors down from them. And I walked in, I still know all the folks there. And I said, we're having a little protest out here. And their office manager goes, oh God, they let you do something? She said, say no more. I won't call the cops. I'm kind of well known for my, let's see, his locations are Washington, D.C., Martinsburg, and Morgantown. Those are the 3 locations that he has. So it does look like the Martinsburg is his Eastern Panhandle office. And if we want to get together and do an action there, again, have bullhorn, we'll travel. Jennifer's asking, I'm also wondering about the rising cost for the Hope Scholarship. Oh my gosh, I know. And how that will affect public education funding. Read that in 2026, it was sore. Don't understand how we can have items like this in the face of deficits. This is could not agree with you more. And we are at Citizen Action all about public schools. We don't have a specific arm that deals with, with that, but we all cohese together to fight for that as well. And I know that the Huntington chapter of West Virginia Citizen Action is very keyed into public education funding. And if you're interested in starting a chapter in your area, let me know. It's quite easy. And so I think we need to get more people keyed into that. I'd really like to see the public employees groups really get vocal and active about this. The Hope Scholarship is just taking so much away from our schools, and it's frustrating as a taxpayer and who has children in public school. So I see their resources being just dwindled. They just had my youngest daughter's middle school just had to lay off 10 people, and they don't have enough teachers already. And so it's so frustrating. So yes, we need to get more active on that. I completely agree. And sooner rather than later. So if anyone has suggestions on what we can do to help with that, let me know. I may be doing healthcare, but I'll branch out. I have no problems with that. That's something I'm very, very passionate about. And Oh my gosh. Jennifer says they're also hearing from our local EMS folks that they're not getting funded and that the Wood County EMS just plain folded up. We're rural and cannot manage without this service. And this is going to get worse with cuts to Medicaid too, because some of the rural hospitals and rural EMS get funding for transports that way, I found out. And so I am so sorry. It's just beyond ridiculous how we're being gutted, just completely gutted. So what can we do right now? Well, I'll put some resources in I've got some messaging resources that are really good. So if you don't care to take the time to kind of look them over when I send them to you, they've got some great talking points. Because like I said at our last meeting, a lot of groups are focusing on how all of these things are tax cuts for the rich. But that message isn't really polling well with either politicians or your neighbors, and people around you. That messaging is just it's not going over their heads. It's just, it's just not plugging in. The things we need to focus on is how it's going to destroy our rural hospitals and rural providers who will either be shut down or have to give uncompensated care. It's going to decimate our nursing homes. And a lot of people don't understand that when you go into a nursing home, you become like Medicaid, Medicare, dual eligible, and you get funding from both in order to get that care. And so people aren't going to be able to afford this out of pocket. And they're not going to be able to work because they're going to have to be caring for a family member. And I mean, we're just going to see a lot of just horrible things to our elderly population, our seniors, our people, our individuals with disabilities, and children. Those are the three groups that are going to be the most devastated by all of this. And those are our three most vulnerable populations. And so that's the messaging we really need to get out. And also, reinforce that it's not individuals. I mean, yes, there are going to be people who take advantage of the system. That's going to happen. However, that's not happening at the rate and at the level, the money level, that fraud is happening with Medicaid through providers. And I'm not bashing providers. I'm just saying you have some unscrupulous ones who are doing the wrong thing and taking advantage of a situation. So those are the points we really need to hit home when you're talking, when you're talking to folks, when you're talking to your neighbors, when you're speaking, with politicians. And I'm going to do a video about calling your politicians. I love to do it after business hours because people can't be crappy to you. You're never going to get through to the senator or the congressman or anybody anyway, at least at the national level. State level, you will. Some of them have their own cell phones listed, so jump on those. But, just leaving a message and how to leave a message and what to say. And I've done it before when I was doing insulin work with Senator Manchin, and I actually got a lot of people engaged to call. And it's just really important. They do have to log your calls and log your stance. So those calls do get counted. I know it feels like we're doing it every day and we're banging our head up against a wall, but it really does make a difference. Because when their numbers go up, call in numbers go up, they panic a little. When their phones start ringing off the hook, they know we're watching. And so it's very important to make sure. Oh gosh, Amy is a social worker at a nursing home, and she has folks that have no family at all. And what am I to do with them? Oh, okay, I'm gonna cry is what I'm gonna do first. Oh, things like this just break my heart. I want to help everybody. If I win the lottery, I'm just giving it to but yeah, cost of care group homes do not leave any funding other than spending for the recipients for personal needs after cost of care has been paid. What's going to happen? Yeah, we need to be the flea in our reps behind and taking all these messages to them, both at the state and the national level. Don't let any of them off the hook. But I will put in there in our email. Your email is going to be chock full of information this month, so make sure to check it out. You know, how to find your representatives if you don't already know what their numbers are. And like with the congressman and Senator Capito, I call all their offices. I let all of them, DC, local, all of them, I let them all know that Manchin's office knew me as soon as by caller ID, as soon as, hi, Mindy, how are you today? We know why you're calling. Yeah, just letting you know again. The question is, how do we know they are receiving our voicemails, letters, and reading them? How many of those calls get through? I mean, like I said, they have to log them. And they do go onto a voicemail system, and that, you know, they do have to log the amount of calls that are coming in through their line, and those are tracked through their calling system. If you feel more comfortable calling during business hours, absolutely do it. I have 4 kids, so I get interrupted, you know, at a moment's notice. They're all actually out of the house right now. That's the only way I'm able to keep any amount of wit about me at all right now. The husband took them all somewhere. So, does anyone else have any questions, thoughts, opinions? We've got about 15 minutes. Do the offices give a breakdown of number of supporters versus dissatisfied? I don't know that they publish that, but they are supposed to, their logs have to indicate what your position is on a particular issue. So I've never seen an actual publication of those logs, but I'm sure they exist somewhere. I'll look into that a little further too. That's some good investing. I'll put my husband on that. He loves to dig into things like that. So I'll give him something to do this evening. Are we feeling okay? I know things are coming fast, furious, and exhausting. I want to encourage everyone to take some moments to breathe and take care of yourselves. You know, we listed some things we were excited about for spring in our opening. Let's get outside and breathe some fresh air. Let's, you know, do some things for ourselves. Oh, the post office stuff. You know, I don't have a lot of information. If anybody else knows anything about the post office situation, please, please get in. But in order to, you know, keep fighting like we need to, and we're going to be fighting, make no mistake, we also have to kind of take a break. The day I got back from DC, I was starting to feel yucky. And so while I was in the car with Gary, I wore a mask because I just knew something was coming. And when he dropped me off from DC, I came in my house and just collapsed and ended up having flu A and was down for a good 2 weeks. I'm still really kind of fatigued, but I'm getting a little bit better. My husband is still fighting it. He's still got bronchitis from it. So, and that was just my body's way of saying, okay, you got to take a break here. You got to settle down a little bit. So don't get to that point. Take care of yourself, engage in some activities that are meaningful to you and renew your spirit and renew your sense of calm. I am going to put the link to the evaluation here, and I'll also put it in the illustrious email I keep talking about that you will receive tomorrow. It keeps getting longer, so I'm gonna have to get up earlier to get going on it in the morning. But if you could please take a moment to fill that out. It really is important and meaningful to me personally. I like to know that I'm bringing you information that you need and you find useful and actionable. And give me suggestions for what we can continue to talk about. I know these issues are top of mind for us, and right now with everything going on, we've got to really make things happen. So again, if you're having something in your area, let me know so we can amplify it for you and on our social channels. We want to get things out and get people activated and engaged, absolutely. So that we keep the heat. We've got to keep the heat on these folks. They aren't going to do it for us. They're not going to help us out. Sally, you posted a link in there. You want to talk about?
That's to the post office action. Someone was asking about in Charleston tomorrow. It's national. It's happening different places. I'm not sure where you're located, but if you're near Charleston, come join.
Absolutely. Let's engage as much as we can. And if making phone calls from home is what you're able to do, hey, that's action. That's what we're doing. And so every little bit helps right now. We can't just sit back. Talk to your neighbor, even talking to your neighbors, talk to your family, tell them what's going on. And, because people are getting their news from so many different places. We have to actually engage with each other to really get the facts out and what's going on. And so, reestablishing our communities is what we have to do. And by communities, I mean even our clubs, our crochet clubs, our gardening clubs, things like that. We can still bring these things there and really engage our communities. I want to respect everyone's time. I'll hang out for the next few minutes if anybody has anything else they want to bring up, but I appreciate you all. Mac, did you have something you wanted to?
Yeah, just fill me in about this post office thing. Do we still have the central post office in Charleston, or has that been closed and moved?
No, we still have it, but parts of the functions I think have been moved to Pittsburgh, but we still have this mail sorting facility in South Charleston. Yes. But this is about don't privatize our postal system. So it's a national action with all the postal employees, all of the AFL-CIO affiliated postal employee unions all across the country will be out there from noon till 1. So I'm Rise Up West Virginia is going to take part in that tomorrow. So if anyone wants to come, please do. At the main post office on Lee Street in Charleston, West Virginia.
And it looks like Beckley is having one at the main post office at 2 p.m. tomorrow as well. So if you're in our southern region, please get out there or, let people know so they can get out there and support as well.
If you're really ambitious, you can go to both.
Yeah. All right. Well, I will release you for this evening. Please take a moment to fill out the feedback form. It is really important to me, as I say again. But please take care of yourselves. Take care of yourselves. We've got to get through the long game here. So take care. I adore all of you. Thanks for coming, and I'll see you next month, if not before.
Thank you.
Thanks so much, Mindy.
Thank you.
Wonderful meeting.